um, आज का हमारा टॉपिक है डिमेंशिया. व्हाट इज डिमेंशिया? सो first of all, my own introduction. I am Maratib Ali, and I'm a clinical psychologist, and I've been practicing for a number of years in a private clinic. इसके अलावा I am also doing teaching across different platforms, and I'm also conducting workshops on a weekly basis. So today our topic of our workshop is dementia, and this is actually started कि हमने awareness create करनी है कि dementia है क्या चीज़ है, and what is really the difference. Because हमारी जो society है उसमें सबसे ज़्यादा बड़ा difference ये आता है कि people don't know about the psychological disorders, they don't know about the mental health conditions, जिसकी वजह से जो मेंटल हेल्थ का ट्रीटमेंट है वो बहुत डिले होता जाता है. लोग लेके नहीं जाते पेशेंट को साइकोलॉजिस्ट के पास. लोग उसका ट्रीटमेंट नहीं कराते, और जब उसका काफ़ी ज़्यादा डिले हो जाती है, काफ़ी ज़्यादा बात बढ़ जाती है, तब उसको लेके जाया जाता है साइकियाट्री वार्ड में, और वहाँ पे फिर उसका ट्रीटमेंट स्टार्ट किया जाता है. व्हेन इट कैन हैव अ मच बेटर रिजल्ट अगर शुरू में ही उसका ट्रीटमेंट स्टार्ट करवा दिया जाए. सो वी डोंट हैव अ लॉट ऑफ इंफॉर्मेशन अबाउट दिस साइकोलॉजिकल डिसऑर्डर्स, जिसकी वजह से इस किस्म की वर्कशॉप्स अरेंज की गई हैं. आज का टॉपिक है डिमेंशिया, ताकि लोगों को अवेयरनेस हो व्हाट एक्चुअली इज डिमेंशिया, इसको ट्रीटमेंट इसका किस तरह किया जाता है. और वी विल स्टार्ट फ्रॉम द बिगिनिंग, what is dementia, and then we are going to start with the types of, we're going to discuss the types of dementia. फिर इसको डायग्नोज किस तरह किया जाता है और इसका ट्रीटमेंट किस तरह किया जाता है. I don't understand Urdu, I'm sorry. Yes, this workshop is actually both Urdu and English. I will speak in English as well. आप सब लोगों को इंग्लिश समझ आ रही है? हेलो, अपना माइक अनम्यूट करके बताएं
यस
आप.
सर। यस सर, थैंक यू सर, समझ आ रही है।
ठीक है. So today we are going to be discussing dementia, what is dementia, types of dementia, and इसके symptoms of dementia, and stages of dementia, and what are the causes of dementia, and lastly how it is treated. इसका जनरली बेसिकली इसका dementia has no cure. We do not have its cure. We cannot treat it successfully because of that. But there is a type of dementia which is a reversible dementia. When we treat its causes, we can treat the dementia itself as well. So let's begin with what is dementia. Dementia is basically something that involves a decline in mental abilities that we need for our daily living. Decline in mental abilities. Mental abilities are those जिसमें हम लोगों को which include learning, memory, decision making, language, whatever I'm speaking. All of these abilities constitute dementia, constitute mental abilities. And when we have started problems with these, इसको हम फिर कहते हैं dementia. Anyways, it is not, let's say it is a combination of different symptoms, and it is caused by different brain diseases. Dementia means forgetting. कोई भी चीज जो है वो आप भूल ही जा रहे हैं. You are forgetting something. That is dementia. Forgetting is dementia. Now, in daily life, as we know, we can in daily life we can forget many things, and it actually is a blessing. Normal forgetting is actually a blessing. Because of which we can function normally throughout the day. We can sleep well because we have forgotten a lot of the stresses that occur during the day. So if we remember every single thing, we won't be able to sleep at all. So it is actually a blessing. Now, when this this forgetting becomes extreme, it reaches to a level that it starts interfering with our daily life, and it starts affecting our memories, our learning. We cannot learn new things, our decision making. Then it starts becoming a problem, and that's when we call it dementia. So iske काफी सारे causes हैं. We have a lot of causes of this. First of all, it can be contributed. It might be because of the age. related factors. A person is above 65 years of age, it is considered, it is a normal thing that he is forgetting all of these things, and it's considered normal. But many people do not forget anything even after getting to the age of 90. Recently, someone died at the age of 140 in Saudi Arabia, and his memory was completely fine. He had no problem. So let's first discuss what are the types of dementia. There are three types of dementia. First is the primary dementia. Primary dementia is the main cause of dementia. It does not occur because of any other disease. It occurs directly because of some brain disease. Like, for example, the most common is Alzheimer's disease. Yes, कोई question पूछना है? Yes, do you want to ask a question? Okay, so there are three types of dementia. First is primary dementia, and in primary dementia, we have the disease, the dementia that is caused directly by a brain, by a disease that is related to the brain. And the most common disease is Alzheimer's disease. Now, with Alzheimer's disease, and other types of primary dementia, the what happens is the brain's cells starts getting reduced. There is a brain damage within the skull that is going on, and because of that, dementia occurs. This is the primary dementia. And as I said, it is Alzheimer's disease, frontotemporal dementia, Lewy body dementia, vascular dementia, and mixed dementia, which occurs because of two or more causes. So this is primary dementia, which is caused by directly brain's damage to the brain. That is called primary dementia. Now there is also a secondary dementia. It can occur because of another medical condition that does not directly affect the brain, but actually affects brain's functions, like infections, for example. If you have infection in any part of your body, there was a famous infection that was the Blackbeard, the pirate had it. It's called syphilis. And because of syphilis, dementia starts occurring, and person starts forgetting their autobiographical information, who they are, and everything about them, and they forget a lot of things because of that. So that type of infection then causes brain dysfunction, and that then causes dementia. So this is the secondary type in which brain is not directly affected. Now there is also reversible dementia. This is the third type in which अगर ट्रीटमेंट दिया जाए, we give a treatment to the patient then starts becoming better. And this is called reversible dementia because इसको reverse किया जा सकता है. We can reverse it. So that's why it is called reversible dementia. So अगर do you guys have any problem with me speaking in English? Say so ताकि मैं उर्दू में बोल दूं. You guys can unmute your mic and speak. Hello, can you guys hear me? क्या आप मेरी बात सुन सकते हैं? Okay. So we have in dementia, let's now discuss about its various symptoms that we have. Various symptoms can be difficulty in sharing thoughts. For example, forgetting what you want to say. Like I know what I'm trying to say. I'm discussing right now dementia. So in my mind, it is very clear what I am trying to say. So जो भी मैं आप लोगों के साथ बातें कर रहा हूँ, you can clearly hear me, you can clearly understand me, I know what I'm speaking. So this is normal thing. But once you have started problem sharing these thoughts with other people, you cannot think about what you wanted to say to the other person. That's when we call it dementia. And इसके अलावा we have memory loss. Memory loss is forgetting names, forgetting people's names, forgetting your own name, forgetting past events, and the things you just learned. For example, you just learned how to write your name, for example, and a few moments later you forget how to write your own name. You just learn how to draw a car in a notebook, but a few moments later you forgot how to draw it. So there is a problem with learning all as well. Similarly, if you want to try learn to ride a bicycle, you have just learned it. A few moments later, you completely forgot every single thing that you learned, and this is because of dementia. इसी तरह प्रॉब्लम्स विद फॉलोइंग डायरेक्शंस डायरेक्शंस को फॉलो करना किसी ने आपको बता दी यहाँ से वहाँ जाओ गो फ्रॉम हियर एंड देयर एंड यू देन यू स्टार्ट फॉरगेटिंग वेयर टू गो this is another symptom of dementia. Now, lastly, there is also trouble with language. You cannot really understand what you wanted to say. For example, Urdu is a language, or in English, you start forgetting what English is. You start forgetting words in English. Basically, what is actually going on is brain ke the cells that are within the brain, those are getting damaged because of this dementia. And since the brain, the area of the brain that lets you speak, that lets you comprehend language, once that gets damaged, you cannot speak clearly. And then it becomes a problem. Definitely, if you cannot speak language properly, you cannot speak English properly, then you will not be able to communicate with other people. So, trouble with language is another problem. Sometimes in dementia, people also forget the names of their own children. They forget the faces of their own children. They forget once the children show up in front of them. They say, "Who are you? Who are you? I do not remember who you are." Their own children. They start forgetting their own children. Now, someone asked, I feel like I have those symptoms too. No, it is once you can. Make the distinguish you can distinguish between the symptoms and the normal forgetting by looking at your own life. If your own life is completely normal, like if you're communicating normally, your memory is normal, you can still remember many things, then you can say that you do not have dementia. But once your daily life starts getting impacted by these things, then you say that it is dementia. So that's really the difference between both of these things. Now, let's say behavioral symptoms and what are the psychological symptoms of dementia. Um, the first thing that we feel is agitation, constantly getting agitated. If someone else is talking to you, you're getting agitated, and you cannot speak to them in a normal tone. You constantly start getting angry at them. This is called agitation. So agitation is one of these symptoms. Another is anxiety, consistently getting worried about things. That is also a part of it. And then also depression. You get depressed a lot. A lot of the time you're feeling sad, consistently feeling sad for a long periods of time without relief from it. This is also a symptom of dementia. Now, you can also start hearing or seeing things. This is called hallucination. The very famous case I told you right now, the Blackbeard, the pirate, he had syphilis infection. Because of that, he had brain damage from that infection. And with that, he had dementia. And from dementia, he also had hallucinations. So he did have hallucinations. And there are very famous book about Blackbeard. You can watch it on the Netflix. So those movies all represent what is actually what was going on through his mind, what was his mental state. And he had these hallucinations at the end of that and the end of his life when this syphilis infection was very worse in his time. So hallucination, seeing things that are not there, hearing things that are not there, this is part of the dementia. Similarly, paranoia, you get fearful that other people are trying to harm you. This is also a symptom of dementia. Other people are trying to harm you. You get paranoid. You get very small things. With very small things, you get very angry. Why that person is doing this? He is trying to harm me. He is trying to kill me, maybe, or harass me. This is paranoia, and he gets very paranoid because of this dementia. Now, another symptom is fidgeting or repeating movements. Fidgeting or repeating movements mean like this, like happens in Parkinson's disease, consistently moving your hands, fidgeting your hands without having any control over it. This is another symptom of it. And lastly, we can say that we also have sleep problems. In sleep problems, then he is also unable to sleep properly. 8 hours a day, he cannot sleep 8 hours a day, and that again becomes a problem. And that is also a problem with dementia. Now, these problems they also overlap with other disorders as well. But to diagnose dementia, that this person has dementia and not anxiety or any other mental health disorder, first thing you need to look at is that the person is showing the signs of memory loss. And if he is showing the signs of memory loss together with anxiety, depression, sleep problems, hallucinations, then you can say he has dementia. And because of the dementia, he's exhibiting these behavioral problems. But if his memory is intact, he can remember everything clearly. He can speak clearly. Uh, he knows his language clearly: English, Urdu, Bengali, any language, Arabic. If he can speak clearly, it means that he does not have dementia, but instead he is suffering from another mental disorder, which could be schizophrenia, which could be insomnia, which could be anxiety, depression alone. So this is how you differentiate between the two. If a person has memory problems, he has dementia. If he does not have memory problems, but all the other problems, then he has another mental health disorder. Now, in dementia, there are three stages: early and middle stage and late stage. Um, can memorizing the Quran help? Someone has asked, can memorizing the Quran help prevent these symptoms from getting worse? The symptoms are similar to those of ADHD except memory loss. No, there is no cure for. My answer is there is no cure for dementia. There is a reversible dementia. We can cure it with by giving them vitamin D's, by curing their alcohol addiction. With that, memory can be restored because it is a reversible dementia. But once it is any other kind of dementia, primary or secondary dementia, and those dementias because of the damage to the brain, once the damage to the brain occurs, there is no reversing it. You can only manage it, but you cannot reverse it. So you cannot prevent these symptoms from getting worse. You can actually manage these symptoms throughout the rest of their lives. And how you can manage that, I will teach you when we get to the treatment part of it. But other than that, it is not really a curable disease because it occurs due to the damage to the brain. But at this time, we do not have cure. Maybe in the future, we will have a cure. So, in ADHD is basically the same. ADHD is a neurodevelopmental disorder that occurs at the early part of childhood when the person is born. While dementia does not occur at that time, it occurs very late in life. Maybe at the old age, 60 years and above age, or it occurs um, very late in life. I would say when he's completely adult, then dementia can occur, not before that. But whatever happens before that, it can be neurodevelopmental disorder, especially if it starts from childhood. It can be ADHD. So in early stage, it is not very severe. The daily life is not very severely disturbed. You can have small. You can notice small problems. You can start notice small problems, and they start getting worse. For example, they start with the small memory problems, small thinking problems. But at the same time, you can also do your entire day's work normally. Like you can dress up normally when you wake up. You can dress, you can bathe, you can brush your teeth, you can make your breakfast. When you can do all those things and you have very little memory problems, then that is actually just the start of dementia, very early stage. So that is the early stage. In the middle stage, now it becomes harder to do these daily tasks. Now, the daily tasks are the main thing to be considered in any mental health disorder. In all of mental health disorders, psychiatry, psychology, daily life is the most important thing to consider as a psychologist. If a patient is having problems in daily life, it means he has a certain type of disorder. Either he has a problem with sleeping, taking care of himself, taking care of his hygiene, doing all of his daily tasks, doing university assignments, doing work where he works normally. When he is doing normally, everything is normal. We get to say that he has no mental health disorder. When these things starts getting disturbed, he starts having reduced performance, reduced sleep, reduced hygiene, then we say that he has some sort of mental health disorder. Then we move forward and try to discover what is actually going on with the patient, what is the actual mental health disorder he's suffering from. So one of those disorders can be dementia, which we are discussing today. So in the middle, as I said right now, he does not have a lot of problem with daily living task in the early stage. In the middle stage, he's starting it. He starts having it difficult to do daily tasks, and he the problem with daily tasks is he's forgetting these tasks. Now, in other mental health disorders, he's having difficulty performing these tasks, but he can memorize all these tasks. He knows I have to do this, that, this, that, this, that. I have to wake up in the morning. I have to go bathe. I have to then go to the university and do the assignments and do homework. He remembers all that, but he has difficulty doing those things in other disorders. In dementia, he forgets these things. So the memory loss is the main thing to be considered here. He forgets that he needs to bathe. He forgets that he needs to go to university. He forgets which class it is. He even forgets which university he studies in. That's dementia. That memory loss is the major component of it. Because of the memory loss, the daily life becomes harder and harder and harder and harder. He cannot remember how to make breakfast, how to make eggs, and how to make paratha or how to make a sandwich. And he cannot sometimes even forgets to make a breakfast. He ends up in university but does not know that I had to make a breakfast, or I had to change my clothes, I had to bathe. He completely forgets it. So this is another symptom of it. It is because of the memory loss it is occurring. In the later stages, you need last stage of dementia, you need full-time care. You cannot really live independently. You cannot live in your house alone independently throughout the day. You need 24-hour care from someone else to take care of your bathing, to take care of your brushing, your breakfast, your everything, every task. You need someone else's help. No, I had a very, when I was a child, I saw a case on the television, and it was a true story. It was a documentary about it. It was about Alzheimer's disease, and Alzheimer's disease does come under dementia. So what happened was this: there was a man, and it was a very old. I think it was a story from the 1990s. I'm talking about very old story. There was a person in America, and he had a very beautiful house near a river and in a beautiful forest. And there he had this problem. He started forgetting his daily tasks, like when to wake up, when to brush his teeth, when to change his clothes, when to make breakfast. All of these things started forgetting. So what he did as a solution, he made a note, and in the note he started writing everything. When I wake up, I will brush my teeth, I will go to the toilet, I will change my clothes, I will then make breakfast and then eat my breakfast and then prepare myself and go to my workplace. And then what have started happening, he even started forgetting to even look at those notes. He started forgetting just to look at those notes. And that then becomes a problem. He's not even able to do that basic task, to just look at the note that he has with his table near his bed. He can't even do that. And when this late stage of dementia occurs, then you need someone else's help to perform your daily functions. And it is definitely a problem. Like, you're not able to bathe, you're not able to dress, it becomes a problem. No, the same thing occurs in intellectual disability as well. In intellectual disability, also a person is not able to brush his teeth, bathe, or change his clothes. But the difference is intellectual disability starts at the childhood when the child is born, and dementia occurs later in life, because later in life because of some brain damage. But intellectual disability is very early on, and it is usually very stable throughout the life. It does not change. It does not become better or become less. So, relatively stable, I would say. It is not 100% stable, but relatively stable. So you can see that, and they don't have really have problems with memories. If you tell them something, they usually do remember what you told them. And in dementia, you have a problem with memory, specifically memory. And someone said, yes, reminders like flashcard, it is helpful for kids' regression in learning. Yes, it is helpful for kids' regression in learning, but in dementia, when once it starts getting worse and worse and worse, person will even forget to just look at those flashcards. And when does not look at the flashcard, again he becomes at the 0 point, and he needs someone else's care. Now, as I said, dementia occurs because of some damage in the brain cells. There is a damage in the brain cells which is causing dementia. And it can be from Alzheimer's disease. It can be due to many causes. And it can also be because of some unrelated causes like alcohol, encephalitis, traumatic brain injury, Wilson's disease, multiple sclerosis. All of these things can cause dementia. And these are all secondary dementia. In primary dementia, there is a direct cause with the brain. And let's now come towards the risk factors. What are the risk factors of dementia? First, the risk factors can be old age. Old age is 65 years and above. When you get old, you have a very high chance of developing dementia. But it does not guarantee that you will develop dementia. Why? Because if you maintain your health, you maintain your blood pressure, and we are going to discuss that a little later, and you maintain your diabetes and other things, then you can live a much better life. Um, so one thing is age factor. In age factor, you might have also seen your grandmother, your grandfather, they're very old. They also get to have this dementia. They forget a lot of things. Sometimes they even forget what the name of their children is. And I've also seen such cases, and this is very common in old age. So one thing is this. Second thing is family history. If you have a family history of dementia, then it can transfer up to you due to the genetics, and it can also be caused by Down syndrome and high blood pressure. Once you have high blood pressure, since high blood pressure is also called silent killer, you can have dementia because of that as well. Because the high blood pressure and high cholesterol can damage these blood vessels, and that can affect the blood supply to your brain. And once that blood supply gets affected, your cells start dying, and once they start dying, it can immediately cause then dementia. Similarly, diabetes. Diabetes, if you don't manage diabetes, and diabetes also the energy is not getting to the brain. Once you start having damage to the brain, you will have damage to you will have dementia. Uh, Now, lastly is serious brain injury. For example, you hit your head very hard somewhere. It can also cause dementia. Now, someone has asked, I want to take care of my mom. What should I do if she forgets me? What should I approach her? She does not use drugs or alcohol. Well, if she starts forgetting me, you have to take care of her 24 hours a day. You have to take care of her clothes, changing her clothes, brushing her teeth, going to the washroom. Even if she forgets you, you still have to take care of her. Take care of her everyday needs. That's what you have to do. Um, so now let's move forward. And what are the tests that can be used to detect, diagnose dementia? One of these can be CT scan. CT scan can be performed at any major hospital. CT scan, MRI scan, PET scan. You can go to a psychologist, psychiatrist to get their mental status exam and a neuropsychiatric evaluation. That can also detect dementia, and also spinal tap, which can be used to detect dementia. Uh, right now, there is no. Now, let's go towards the treatment. Right now, there is no cure for dementia. You have to manage it, and you have to. If you have someone in your family who is going through dementia, you have to help them manage their symptoms. This is the best treatment for it. We do not have such a cure for it at the current moment. Uh, there are many medications that are used to treat the symptoms. Again, that is more of a domain of a psychiatrist. I'm a psychologist, clinical psychologist, so that is not my domain. And there are medication which are used to treat dementia, but not cure it, but manage its symptoms. And what depressant can be used, antidepressants can be used, antipsychotics can be used, and similarly other medication that can be used, which is a domain of a psychiatrist again. Now, another thing which can be used, which are the non-medication use of medication treatment of dementia, which can be, you must manage your health first. It is very, very important to manage your blood pressure and diabetes as well. If you have any of these diseases, you must manage them under any circumstance because they can lead to not only dementia but many other diseases as well, like kidney failure, eyesight failure, eye failure. That can also be caused because of this high blood pressure. So you need to manage these two diseases under any circumstance. And if you go to a hospital, you will see every other patient is suffering from diabetes or high blood pressure. Literally every other patient. There are so many patients. I would even think that there is no street on earth where you won't find a patient which is suffering from diabetes or hypertension, high blood pressure. So these two diseases are very common and they must be controlled under any circumstance. And they're very dangerous if you don't control them. For example, in Mexico, there they have a lot of this culture of drinking a lot of Coca-Cola. And once they drink a lot of Coca-Cola, they get diabetes. And I've seen it in documentaries. People with diabetes, despite of having diabetes, are still drinking Coke, still drinking juices, and they're not stopping. And because of that, they're getting kidney failures. And kidney failure is when the patient has died, people have come to his funeral. On his funeral, also, they are drinking juices. This, so, definitely, we need this awareness. We need to know what is causing this kidney failure, this such a pandemic, such a healthcare crisis in the whole world. This diabetes, this hypertension, these need to be controlled under any circumstance. And first thing to control is taking the correct medication that the doctor gave you. Second thing is getting good exercise. These two are very important things. Follow doctor's instructions and do daily exercise. And of course, prevention is always better than cure. If you do not have any of these diseases, try your best not to eat too much salt in your food or too much sugar in your food. These two things, if taken very in large amounts, can definitely cause diabetes or hypertension. So definitely these two things must be controlled first. And these are most important things to be controlled in dementia as well. If you have these things, must control them under any circumstance. Now, second thing you can do is if you have a brain tumor, you can perform surgery to remove that brain tumor. You must start eating healthy, balanced diet foods so that you get all the ingredients you get that your brain needs. You need that, very important. Similarly, exercise. Exercise is extremely important. If you can daily exercise for a half hour, 1 hour, if you do something that you like, for example, cycling, you can see a lot of very beautiful scenery while cycling. Cycling is also very good exercise that you can do daily. It is a low impact exercise as well, very good for your health. You can do cycling, walking, going to the gym, anything for half an hour daily at least. You should do so. It will also help if you have diabetes. It will help you control your diabetes level, sugar levels, and it also help you control your blood pressure as well. So both of these are the benefits of it. So this is all about dementia. If you have any questions, definitely unmute your mic and ask questions. If you have questions in Urdu, still ask.